labor shortages across all industries, and hospitals are no exception. Covenant Health is reporting it needs more than 200 employees here in Lubbock alone.
KCBD News Channel 11's Patricia Perry joins us now to look at the cause and the effects. Patricia?
Karen and Abner, the Talent Pipeline Program Manager Terry Morris says Covenant is short in all positions ranging from the door greeter to experienced RNs. Covenant has 4 campuses to fill with employees in Lubbock, Plainview, Levelland, and Hobbs, New Mexico. Where she sees the most need across those campuses is in nurses, which she says is crucial to have.
We have to make sure that we're providing safe patient care, that the acuity or illness of the patient matches what type of nursing care they get.
Morris says this all started when the pandemic struck.
With COVID, we lost a lot of our healthcare professionals that, just didn't want to be in a hospital. There was a lot of unknowns. And then, of course, the nursing travel industry is big.
She says part of that could be nurses retiring early due to burnout. But she says Covenant is trying to help its employees.
Our hospital's done a lot to combat that. And we have a lot of mental health initiatives for our caregivers to help them kind of get through that burnout.
And as those employees become harder to find, wages increased, which is something Covenant is struggling to contend with.
We are a nonprofit hospital, so we're still in that market of having to compete for all levels of education, all levels of positions, from entry all the way up to your professional level.
But she wants to emphasize, you don't have to be a registered nurse to get hired at Covenant. They are even in need of social workers and case managers.
We're really short in almost all positions. I tell everyone we're like our own city, and I think people always think nurses and doctors.
Adding on to that, Morris says graduate nurses can now walk across the stage out of nursing school and into almost any position with a lot more opportunities before getting their certification to be an RN. She says Covenant has a lot of graduate nurses. It's mainly lacking experienced RNs. Karen and Abner.
Thank you, Patricia.